Dr. Patino here at the Cosmetic Surgical Center of Rosarito. This is micro air, power assisted, meaning that I turn this electric tool on and the tip vibrates. So you're gonna be the first ones to see what comes out of these, right? And what we want is beautiful yellow fat, right, Gabby?
Right.
And so this patient has had liposuction before, so she doesn't have a lot of excess, but she wants more definition, and so let's see if we can achieve that, right? And can you show and see what is coming out when we are doing this procedure? And notice how, what color is that, Elena?
It's yellow.
Yellow, beautiful fat,
Beautiful
right?
yellow.
And notice that my strokes are very, very slow. And so that provides for, number one, safety, right? It's going to be very hard for me to, perforate an organ. Very hard for me to perforate an organ if I am doing this so slowly and so controlled, right? And I'm pressing down here for those doctors watching out there to get deep. This is a Mercedes 4mm cannula. But there is multiple advantages to doing these procedures. That's just one. And of course, we never had anybody have an intra-abdominal or intrathoracic or any organ damage. What happens is when you go too fast and an unintended stroke goes where you don't want it to go, right? And then that could be lethal. And we never had anybody die, and we want to keep it that way. But another advantage besides the safety is that you're gonna get, this output. Wow. And so when you do this, look how my strokes are so slow, and look at the output, right? But if I'm moving my arm very, very fast, then there is gonna be bleeding. It's the speed, causes bleeding. It's like, not a perfect analogy, but it's like having a bullet in your hand and just press that bullet against your other hand. Nothing is going to happen, but if you put it on high speed on a pistol, that bullet is going to penetrate and cause bleeding. And this is basically the same concept, right? If I'm moving my arm very, very fast at full speed, there is going to be bleeding. And again, it's not bleeding that is going to, cause any significant, life. Yeah, so, I was talking to some of my colleagues and they go, well, you're very compulsive about the blood loss. I mean, if you lose 1 or 2 cups of blood or even 3 or 4, it's not a big deal. The patient, I had one of the doctors, he goes, I like bleeding because it stimulates the bone marrow to make more blood cells. And my take on this is that of course I am exaggerated, and but I like it because why lose blood if you don't have to? What's the only reason why you want to do this fast is to get through the case faster, right? But there is no reason to do a very, very fast case as long as you keep it under 4 hours. After 4 hours, the complications. Yeah, but there is the normal things that we know about blood loss that are bad, right? Anemia, right? And when you do lose a significant amount of blood, if you do liposuction, and there could be, 1, 2 cups or even more blood loss, and this will give you anemia for sure. And if you have anemia, then you're going to have lack of energy. If you're going to have lack of energy, then you may not want to walk. If you don't walk, you can get a blood clot. If you can get a blood clot, you can die. That's just one scenario, right? But also, the blood accumulation can, and we know this, cause a hematoma. A hematoma is a collection of blood. If you have a hematoma, then you have more risk of infection. So now you have infection there, right? Now, in addition to And just blood loss by itself is also being associated with infection. You have blood loss and more likely to have infection. Procedures that have significant blood loss are, are the ones that give you more risk of infection, right? Although the risk of infection with this procedure is near zero because, or is minimal because the incisions are so small, right? But there is other things that we suspect that have not been proven. But for example, I personally believe that the blood, when it's not inside the blood vessels where it's supposed to be, is irritating to the tissues. And the tissues reject that blood, and it can form nodules, granulomas, and things that we just don't see, and that's kind of the only explanation